So good afternoon, and we're thrilled to be here today in Chelsea, where we just had a chance to tour the vaccination clinic at La Colaborativa's headquarters, which is currently being operated in partnership with East Boston's Neighborhood Health Center. I want to thank Gladys and the team for hosting us, and to Manny and your team for all the work here at the health center that you're doing to make sure that we get people vaccinated as quickly as possible. And I also want to say thanks to City Manager Tom Ambrosino, who's been a terrific partner on so many issues. And I also want to say how much I know the Lieutenant Governor and the Secretary and the Senator appreciated the chance to tour the food pantry today with you, Gladys. That was quite an experience. Not one we will soon forget, I can promise you that. We're here today to talk about COVID and the work that's being done to support communities like Chelsea, helping residents get vaccinated and helping the community deal with and recover from the pandemic. I do want to give a quick update on COVID-19 cases, hospitalizations, and vaccinations. Yesterday, the Department of Public Health reported 2,252 new cases out of 115,453 tests. And I just want to say that while there's been a significant decline in daily testing nationally, the Massachusetts test counts have actually stayed pretty high. We were somewhere in the vicinity of 85,000 to 95,000 tests through the fall and through the beginning of this new year, and we're still clanging around somewhere in that general vicinity of 85,000 to 95,000. The national numbers have moved from around 1.8 million at the end of calendar 20, the beginning of calendar 21, to a number that looks more like about 1.1, 1.2 million a day. We think that's a good thing. We think testing is important. It's important for lots of reasons, but the biggest one is it helps us continue to identify positive cases so that we can then work with our local communities and our collaborative efforts around contact tracing to make sure that we help people isolate and get the support services they need to help stop the spread. Nearly 19 million tests in total have been conducted here in the Commonwealth. We currently have about 690 individuals in the hospital with COVID, and about 170 are in the ICU. We continue to monitor that data every day to continue to manage and adjust accordingly to deal with transmission and with COVID. Like many places around the country, we've seen an uptick in new cases, and as I mentioned earlier this week, the largest growth in new cases in our state is occurring in people under the age of 40. In fact, the numbers among those over the age of 70 have dropped dramatically since January, which is a really important sign with respect to the importance of the vaccine, given that at this point in time, more than 80% of the folks over the age of 75 in Massachusetts have been vaccinated, and more than 70% of the people over the age of 65 have been vaccinated. Worked really hard early on that vaccine rollout program to get there, and it's made a really big difference. And having so many of our seniors vaccinated at this point helps keep down both cases, but equally importantly, hospitalizations, and in many cases, death. Overall, we've administered about 2.3 million first doses, including the single-dose J&J vaccine, and over 1.3 individuals here in Massachusetts are fully vaccinated. We've been a national leader for the past several weeks, outperforming almost every state in the country, and we continue to rank #1 among our peer states, the 24 states that have more than 5 million residents. We rank #4 nationally in first doses administered, and we've been in the top 10 of all states for months now, something everyone here today should be immensely proud of. As we distribute vaccine across the Commonwealth, we continue to focus specifically on the 20 communities that have been hardest hit by this pandemic, communities like Chelsea. With a large population of essential workers and people of color, Chelsea's been disproportionately impacted by COVID-19, and we've been working with local officials and community organizations over the past year to respond to that. We've supported La Colaborativa and other organizations through our $65 million food security program. Lots of comments today about the truck. And we work together to help families keep food on the table. We've provided free asymptomatic COVID-19 testing through our Stop the Spread program. There are 4 testing sites in Chelsea, including one of our free Stop the Spread sites, which is run in partnership with Beth Israel Deaconess Medical Center. We've also worked with local officials and organizations to provide multilingual public health outreach and educational efforts here for residents. And just this past month, we worked with the local leaders to ensure that Chelsea got the support it deserved from the federal relief package. As many people know, the federal bill, as it was passed, had funding restrictions that severely limited the dollars that would have gone to some communities in Massachusetts that were hardest hit by COVID, including Chelsea and Everett, both of which are in Senator DiDomenico's district. So it probably shouldn't come as much surprise that the first person I heard from at the state level, after having conversations with folks at the federal level, was Senator DiDomenico. And we very much appreciate the relationship, but also the heads up with respect to that issue. We work directly with local officials, including folks like City Manager Tom Ambrosino, to ensure that these communities would have access to appropriate funding levels to support their needs. And last week we announced that we would direct an additional $100 million to Chelsea, Everett, Methuen, and Randolph after our conversations with these communities. These communities will be able to use that $100 million in direct aid to support costs related to the COVID-19 pandemic, including direct response efforts addressing negative economic impacts, replacing revenue that's been lost during the pandemic, making investments in water, sewer, and broadband infrastructure, as well as many other eligible expenditures. As we look ahead to the rest of the vaccine rollout, we're committed to ensuring that communities like Chelsea get the support that they need so that people here can get vaccinated. Earlier this week, we visited the Hines Veterans Convention Center to highlight our new partnership with FEMA that designates the Hines as a federal mass vaccination site, which will bring 6,000 additional daily doses to Massachusetts. And even though the site's in downtown Boston, the new partnership is good news for the region because our collaboration with the feds allows us to create a hub-and-spoke model, which allows a portion of the doses that we get from that central hub to be distributed to nearby communities through mobile vaccination units and pop-up clinics with a focus on vaccine equity. So starting next week, we'll be working with municipalities to launch mobile vaccination efforts in Chelsea, Revere, Boston, Fall River, and New Bedford. And like the Hines Convention Center and other federally supported sites around the country, these cities were selected based on the CDC's Special Vulnerability Index and their proximity to the Hines. These mobile efforts will ramp up over time, but we'll get up to doing 500 vaccines per day in each of these communities. Doses will be picked up by the mobile vaccination teams at the Hines and then distributed and administered in these communities. Most of these mobile units and pop-up clinics will set up in city parks, parking lots, and other places that are easy to access for community members. And the program will also include grassroots efforts in each community to raise awareness about these mobile clinics and assist in booking appointments. The mobile vaccination program will kick off, as I said before, next week, and the program, like the broader program with FEMA, will run for about 8 weeks. The mobile programs, in addition to the homebound vaccination effort that we launched last week, and will specifically focus on people who can't leave their homes to access the vaccine. We're also investing over $20 million across the 20 hardest hit communities in Massachusetts to reduce barriers to vaccination and promote equity in vaccine distribution, and that includes a mix of state funding and federal funding, which we recently received from the CDC. Today we're glad to announce details for how some of those funds are going to be spent. The Department of Public Health is awarding $4.7 million directly to municipal governments and local boards of health in each of those 20 prioritized communities. These grants will support staffing and public health infrastructure, along with efforts to coordinate vaccine clinics and promote vaccine trust and confidence. Chelsea is set to receive about $150,000 from this grant, and we look forward to awarding more out of the $30 million equity program in the next few weeks. Secretary Sutters will share more details on this grant in a moment, as well as details around some of our door-to-door efforts in many of these communities to promote access and awareness to vaccine. Before I close, I want to offer some quick thoughts about staying safe over the course of the next few days. Obviously, Passover started last weekend, and Easter's coming up this weekend. We know these holidays are very important to people, and they're a very significant opportunity for folks to gather with family and friends. I know people have heard me say this before when it comes to celebrations of all kinds. These celebrations, in many respects, really do need to look a little different this year than they have in past years, but I would say just this year. Be great if people could continue to celebrate with their immediate household. If you spend time, any length of time, with other people, we urge you to wear masks and to maintain a certain amount of distance. Don't share drink or food. And if you do have a small celebration and the weather holds, consider holding it outside. If you can't celebrate outside, crack open the windows and make sure there's ventilation flow across the rooms you're all congregated in. And you don't have to crack them very far. If you literally crack the windows about this much, you'll get the 4 to 5 times an hour airflow that people talk about as being critical to supporting you in those situations. And when you do gather with your family and your close friends, we please ask you not to drop your guard. The virus, as we know from previous holidays, has a particular opportunity to spread in those environments. We saw it happen at Thanksgiving. We saw it happen at Christmas. Let's try and make this particular weekend a little different than what we saw at the previous two. We know we have an opportunity here with vaccines to continue to put 50 to 60,000 shots in arms here in Massachusetts every single day. And it's going to be an effort that we believe can ultimately be successful, which will give us all an opportunity to get back to what we think of as the normal that we left behind. But I can't tell you how important it is for people to continue to be vigilant, especially as we move toward the warmer months here in Massachusetts, and to do all you possibly can to recognize that we have made progress, you have made progress, but we still have work to do, especially with the new variants that are on the ground here in Massachusetts, elsewhere in this country, and around the globe.